Hi everyone, and welcome to another episode of Ask Adam. Second time in as many weeks for us, Adam. How are you?
Yeah. Good, thanks, Stephen.
Good. This will likely be a slightly shorter session, as we're aware that there were some questions we couldn't get to last time round. So we'll run through those today and a couple of new ones. We've got a good mix, I think, covering staff wellbeing, break entitlements, through to service updates, Dr. Graves, and ideas for winter uniforms. So as always, I'll run through each question and Adam will share his response. Let's get straight to the questions then. Question one is a question from a colleague in anaesthetics at Aberdeen Royal Infirmary on the topic of the previous staff gym. And they ask, when will the staff gym be reinstated? I've heard lots of positive feedback from staff who had previously used this gym, the impact on their well-being and the ease of incorporating physical activity in their busy shift patterns. As you know, it can be very challenging to incorporate routines and shift work, and I think there would be huge appetite for the gym to be reinstated.
Yeah, thanks. Thanks for the question, and I'm really glad we've just got an opportunity to pick up the ones we didn't manage to get through last week. So, this one about the gym. I'm guessing this person's not aware, but we actually made a formal decision as an organisation about 18 months ago to not reopen the gym. So it was a really difficult decision. It was a bit about money, mainly about space, and actually just having a venue that was fit to have a gym, and where we could still do that and all the other challenges we've got around space. And I'm sure everyone's very familiar with the space. And there was also a little bit, I think, as we worked in partnership around it, around equity across our system and access to gyms. So the solution was, and this was a bit about equity, was that we provide some support for people to be able to access other public gyms and I think some private gyms, I think like the sports village and things. So we can put some information hopefully at the bottom of the screen about how people can access the support to be able to go to these other gyms on a subsidized basis. So at the moment, absolutely no plans to re-examine this or anything. Really keen to make sure people have access to be able to do physical activity, including the use of gyms. And I understand that's disappointing, all those things, but that's the position we're in at the moment, as it were, around the gym use.
Okay, thanks, Adam. I think a lot of people were aware of the decision on the gyms, but there was a lot of feedback about it at the time, and I guess we thought it was worth including this question.
Yeah.
So maybe some folk that have missed it. So thank you. Question two is from a team member in radiology at Aberdeen Royal Infirmary, and they write, is there any update on the salary sacrifice car buying scheme for staff? The last mention on Ask Adam said something would be announced in February.
Oh, we're dead close. Working group, just ironing out the last couple of little niggly things. We'll get an update as soon as it's super close, and will be really exciting. So hold this space for a second, then we'll give an update as soon as we can.
Okay, thanks, Adam. Something to look forward to. Question three comes from another anonymous member of staff, but there's a member of nursing staff who works in Aberdeen who says it would be ideal if managers and staff had better guidance on what to do when a member of their staff want to retire or retire and return. I appreciate that there is a responsibility on the member of staff, but my own pension has been delayed for months after having worked in healthcare settings for over 40 years.
Right, okay. Just think about, maybe I could just respond to the individual. So if you could get in touch with Lorraine Hunter, who heads up all of our payroll services, part of the HR centre, then Lorraine will look into your individual case and find out what's happened and explain that to you. So that absolutely respond to that individual and the question. I guess in more general terms, a couple of thoughts from me. Pensions are extremely personal, and therefore there's complexity for us as an organisation because everyone is different. And their situations are different. We've often been asked about, having an advisor to help people with pensions. So we're not allowed to do that. That would be against the law in the financial regulation. So we can't do that. There are, as I'm sure lots of people listening know there are people that you can seek advice from. And then we've got some documents that help signpost people to the right things. So if you go onto the HR service centre, in the intranet, there's a bit on pensions in there which helps signpost you to things. There's clearly the SPPA, the Scottish Public Pensions Authority. Is that right? I think that's what they're called, isn't it? Anyway, SPPA. There's all sorts of guidance there and documents there that can help people work through it. And I know that there are things to support people as they start to think about retirement, put on by SPPA and others. So look at the information that's there, and that individual that's asked the question, if they get in touch with Lorraine, she'll help just understand what's happened there for that individual.
Yeah, thanks, Adam. I hope that helps that individual. And yeah, as you say, pensions is unbelievably complicated, even from the trade union professional organisations perspective.
Yeah, absolutely.
A number of members will ask a number of accredited reps, can you give us advice as to what to do around about pensions? And of course, for the same legal reasons, no one employed by the health board can do that, neither can the trade unions professional organisations. So yeah, thank you. Question 4 is from a healthcare support worker who covers CTAC in GP practices, and they would like to ask Adam about break entitlement. And they say, I understand that the paid morning and afternoon breaks are complementary, and we do not get them if the service is busy. However, while this is applicable to wards where staff look after a relatively small number of patients, in a GP clinic, I could perhaps see a larger number of patients without a break. So as an example, if I work from 8 AM till 2 PM, I will have no paid or unpaid break while potentially seeing up to 36 patients. This leads me to feeling exhausted. Can this be looked into for different services to be more equitable, or is this a set thing?
Right, thanks, Steve. There's quite like that question. So let me just work through that. So there's two bits. There's a legal requirement for breaks. So if you work more than 6 hours, you're entitled to a 20-minute break, and that's the law. I think in the question it was that they work between 8 and 2, so that would just be a 6-hour work pattern. So they're not legally entitled to a break, but certainly at NHS Grampian, we aim to follow good practice, and so we support people to have a sort of a 10-minute paid courtesy break after the 4 hours within a shift. So in a normal shift, you should get 2 courtesy short breaks that just allow you to stop your role. And again, Stephen, you haven't got your at best with rest background on, but again, we absolutely know that if people take breaks, it definitely helps performance as well as all the well-being that this question is asked about. I think you said as well that they work in a CTAC, so in a GP setup. So again, the GPs have slightly different T's and C's than NHS Grampian, as I understand, as independent practitioners, unless of course it's a 2C practice, in which case it'd be our T's and C's. I think what I'd advise to anyone is, regardless of where you work in our system, is it's good to have a short break, and therefore work with your line manager to see how we can schedule that. So I think in this example, could we schedule patients with a very short break that would allow the individual to stop and still for the practice and the work to broadly progress really efficiently, as it sounds. So that'd be my advice. So we've got the legal bit, and we absolutely need to do that. It's crucial. We've got the courtesy bit, which we really encourage and is absolutely, we think, a really important and valuable bit of working for NHS Grampian. So please explore that with your line manager and see how we can make that work.
Yeah. Okay. Thank you. The next question is from an anonymous colleague who works in the community in Moray, and they've got a question about the orthopaedic service and Dr. Grace. So they ask if Adam can give some indication for when some of the orthopaedic services will be restored to Dr. Grace Hospital. If there's no timescale for restoration of service, what is the plan for making the public aware, both in Moray and more widely in Grampian?
Yeah, so I'm really glad we've got this question, and just an opportunity for me to say a little bit about orthopaedics up in Dr. Gray's. So just for anyone that's not aware of what's happened, so we had some unexpected staff absence, and therefore it wasn't feasible to still run the orthopaedic provision in Dr. Gray's. And so we've got the Aberdeen team picking up the demand from what was previously dealt with in Dr. Gray's. So my real thanks to colleagues in Aberdeen who have put that into their work pattern in Aberdeen. We're doing work to see how we manage the elective bit of orthopaedics. So we've got work at the National Treatment Centre in Highland in Raigmore, or not in Raigmore, but in Highland in Inverness. We've obviously got access to Golden Jubilee into Aberdeen, and we need to work that through together to see how do we get a sustainable provision for all of the population of Grampian. So that needs some work. I'm absolutely not able to say here, you know, a week on Monday it'll all be back to what it was before, because I'm not sure that will be the case. We need to do the work. We need to work through how we get to sustainable provision of orthopaedics for everyone that lives in Grampian. I think some of that extra work that's been happening elsewhere, that there are a smaller number of people on the waiting list that were on a separate waiting list in Elgin. So some of the throughput is positive for individuals in who live in the Moray area and would traditionally have been treated in Dr. Gray's. I think the other bit I'm really thoughtful of in the conversations I'm having is around the trauma orthopaedic part, and you know, the fractured neck of femurs that are coming to Aberdeen. I'm really conscious that's a big journey for probably typically an elderly, more frail person travelling down. So again, really thoughtful as the teams do the planning work to think, how do we you know, get the best service that we can with some of the limitations that we've got within our system at the moment. And in terms of I think the other key question there was, you know, how do we let the population know? I'll pick that up with the team who are doing the work around orthopaedics, and obviously in the comms and team, and see how can we give a broader update to everyone about where we're up to, what's the work we're doing to get to a future sustainable provision. So I'm kind of sorry if that's not the answer people are wanting. That I was just going to say it'll all be like this in a second. We need to do the work. I think that's the really key message that we need to get everyone on board.
Okay, thanks, Adam. The next question is from Ryan Hill, who also works in Moray. And Ryan's been in touch to say, from my discussions with colleagues, there's a growing concern and speculation that the current pressures on the NHS, and in particular on Dr. Gray's, may lead to a reduction in local services. While I understand that the recent changes to orthopaedic surgery were primarily due to staff absences, many are worried that this is just the beginning. Several people have expressed concerns that the emergency department may be reduced or even closed, and that theatre capacity could be significantly reduced or scaled back. It would be incredibly helpful if Adam could provide some reassurance, particularly of the emergency department and theatres, to help address these concerns.
Yeah, thanks, Ryan. I think that's a really helpful question. So if there's these concerns in the system, thanks, Ryan, for bringing them up and giving me an opportunity to say something out loud to everyone in one place. I guess there's a couple of things that I'd think about. So the board signed off the strategic direction for Dr. Gray's, so we're pursuing that. We're looking at the moment about how do we get services at Dr. Gray's to work effectively with services at Aberdeen, and services in Aberdeen to work effectively with services in Dr. Gray's, so both ways. And this idea of how do we have provision of service for the population of Grampian with two very important sites, both sites, and there's obviously multiple hospitals, Aberdeen and the hospital in Dr. Gray. So both are absolutely important. So key message, there's absolutely a robust and important future for Dr. Gray's in the provision of services for the population of NHS Grampian. In terms of specifics, I think Ryan's asked about ED. Absolutely, we need an ED. So I think that's okay. And theatres, I think, was the other part, Stephen, of the question. And as far as I can see in the work we're doing at the moment, we absolutely need theatres. Whether we'll use them in the way we've historically used them, I don't know. And like the orthopaedics answer, that's the work we need to do, is understand how do we absolutely get the maximum benefit for theatres across the whole of Grampian, so that they work effectively, they work to ensure we treat patients in the best possible way we can, with the highest volume and efficiency and productivity. So let me be clearer. We need theatres in Dr. Gray's as well, and they will be part of that planning. I guess the bit I'm less sure about as the work unfolds is, how do we use them? What do we use them for? How does that work in that bigger bit? And I guess in being involved in things that affect you, I know there's been a ton of work with all the theatre users in Dr. Gray's, so that work is all part of what's unfolding to make sure we do absolutely the best thing we can do with all of the resources we've got across our system.
Okay, thank you, Adam. Question 7 is from one of the unit operational managers who I think works in Aberdeen, and they say the current measures being implemented with the aim of making financial savings are having a significant impact on our patient care and our staff. I feel we're increasing clinical risk as well as hugely impacting the well-being of our staff, who are often overworked and under extreme pressure. In light of this, it is really frustrating to see money being spent on repainting skirting boards and door surrounds in Ashgrove House. It's hard to imagine how this has been determined as a priority. How can we be sure we have oversight of priorities at this level?
Yeah, thanks to the UM who popped this question in, or comments and question. So first off, I'd just like to acknowledge the huge work that I think everyone's doing around the financial savings, and I agree it's incredibly challenging, and we've still got a long way to go. So I'll not make this one about finance, but my thanks to everyone that is working very hard on the financial position. Right, in terms of the painting, so I think firstly I'd like to say thanks to all of our teams and the painters and decorators. Indeed, thank you to them for the work they do to keep things protected in clinical areas, and therefore enabling us to meet all the requirements of inspection and all those things, and indeed for when they paint in Ashgrove House and things, that it looks good and tidy and fit for people who are working there as well, because it's important wherever we work that we work in the best environment that we possibly can. In terms of Ashgrove being a priority, my understanding is there'd been some leaking, and so there was some required tidying up. I'm less sure about the broader bit of painting that's referred to, but the UM, I would encourage you to speak to Chantal Wood, who oversees this. You're all colleagues. Maybe a conversation about how we prioritize that work would help, and or maybe there's a different way that you could help suggest for them to look at it. But I'd kind of pass that to you, just to have that conversation as colleagues and try and understand how that works. We all have expertise in our own areas, and sometimes we just don't know how it's working in someone else's area. So I'd encourage that conversation as a really important bit about how we work together.
Okay, thank you, Adam. And question 8 is a nurse who works at a GP practice was in touch a couple of weeks back during the snow that we experienced, and says the weather made driving extremely challenging and required her to change her car tyres. She highlights that the cost of that is absorbed by the staff who use their vehicles for work. She also says she feels the uniform in these conditions was inadequate. colleague would like to ask Adam if there is any scope to introduce a winter uniform, for example, a warmer or thermal jackets, boots, and the like, as well as a budget for winter tyres to help keep staff safe.
Mm. Yeah, two really key issues, and again, I'm always really in awe and in great thanks to the tremendous efforts that all of our colleagues make who work in the community to continue to see patients and clients in their own homes and in different clinics, and of course people traveling into centres as well. So um, just that was just a general point, but specifically, so the uniforms, as I'm sure everyone knows, the uniforms are a national policy. It's a national uniform that we get. My understanding is there are some, warm jackets and things. So I would direct the person that asked the question just to check what's available. And my understanding, there is things that are available that are fit for winter use. Uh, so leave that there, and I'm sorry, I feel I'm required to say if it turns out there isn't, please do come back to me. But my understanding is there is kit that's appropriate for such like. And then in terms of the winter tyres, this is a really long-standing issue and has been looked at in partnership. And I see Stephen nodding. So we have looked at it together previously in partnership as an organisation, and the answer remains that we as an organisation don't pay for winter tyres. So again, we could perhaps dig out some of the historic partnership discussion and the conclusions to share with this individual, and maybe we could get through Mike's team, who supports us with this work, through Mike's team, something in the daily brief just to remind people of why we came to that decision and the rationale, because I think it does come round quite frequently, doesn't it, Stephen, that this kind of concern that people have, which I understand fully, but our partnership decision at the moment is that we don't pay for winter tyres. So that's our position. Thank you, Stephen.
Yep. Okay. Yeah. Thanks, Adam. Yes, I recall particularly winter tyres thing being discussed many times, and I think there's an element but it probably links to people's tax and how the HMRC would view
Right.
the employer, meeting the costs of
Right.
things like winter tyres, particularly when winter tyres would be on an employee's car, and obviously not all the journeys are for work.
Yeah.
So I think it strays into that category. I guess as
Right.
well. Having said that, if any employee isn't feeling safe or doesn't feel that it's safe to make a journey or whatever, then that's there are policies and various processes
Yeah,
available.
absolutely.
Absolutely, conversations you should be having with the manager,
Yeah.
etc. So hopefully that's been helpful, even though it's maybe not the positive answers that the colleague was hoping for. So. Okay, thanks again, Adam. That's everything for today. Thanks to all of you who took the time to send in a question. It's always great to get real feedback and suggestions from across the organisation. So if anything we covered today sparks more questions or ideas, or as Adam said, clarifications or corrections, then please send them in. We'll be back next month for another Ask Adam. And in the meantime, take care.
Thank you. Bye-bye.